Welcome everyone back to another episode of Q&A with Sharon and George. I was my mother's caregiver after she was diagnosed with Parkinson's disease until her passing. In her memory, we started Together for Sharon.com to bring awareness and to advocate toward a cure for all those still battling Parkinson today and their families, because no one is ever alone in this fight for a cure. Today's guest is someone who's not just inspiring. I kind of say that for all the guests, but this is above, not above everyone, but above, really meaningful in my heart. One important topic that shockingly is not discussed enough, and thanks for this incredible guest doctor and also their amazing organization that I've been following since its inception, Move to Parkinson's, and we thank the incredible organization who actually also helps them, has brought about a topic that's near and dear to my heart on hallucinations and delusions. And obviously, everybody's journey is different, but unfortunately, my mother ended up with these types of symptoms. And being in law enforcement doesn't train you at all, or even a caregiver, for what I encountered. But today is about all of you, and it's an honor to have you, Doctor, with us here today.
Thank you so much. It's an absolute honor to be here. And thank you, George, for all that you do to support our Parkinson's community. It plays such a vital role. So I really am honored to be here.
It means a lot. And I guess we should start with, if you could tell us a little bit about yourself. I have so many questions that we are limited. I just hope we could get them, because this really, again, I might sound like a broken record, but this topic, I'm kind of shocked isn't discussed enough. But your group and the things that you're all doing at Move to Parkinson's is really opened not just my eyes, but so many to this topic. So maybe we
Oh,
can start.
absolutely, absolutely. So, thank you very much. I'm Dr. Gupta. Fiona is my first name. I'm a neurologist and a movement disorder specialist. I'm based in New York City. I've been in clinical practice for about 18 years and really focused in on just the diagnosis as well as the management and following each patient through their own treatment journey with Parkinson's disease. And so when More to Parkinson's approached me about becoming involved, it was absolutely a no brainer because, yes, we need to do more. We need to do better, particularly with highlighting the non motor symptoms of Parkinson's disease and, in particular, the Parkinson's hallucinations and delusions, which are common and so impactful to patients and their family members. So it's an honor to be here. Thank you.
Thanks. And from a fellow New Yorker, I'm from Brooklyn. Nice to also have you out there fighting in my hometown. So, why don't, before we get to some of the important topics, is there any reason maybe you thought about that this topic hasn't been really brought to the forefront until just recently? And also, if you could touch on, I'm going to share the website in the middle of the show, but maybe, why is it just kind of reaching our fingertips and mouths recently in the last few months?
Absolutely. And I think it's so important to realize about 50% of people living with Parkinson's may experience hallucinations or delusions over the course of their disease. They are kind of maybe non motor symptoms. Hallucinations are things like seeing animals, people, objects that aren't there, but also even in terms of hearing things, voices, music, footsteps. Delusions, some people feel like, someone believes things that are not true, someone trying to harm them, infidelity. And it's really interesting that you brought that up. Why isn't it not touched on more? We know that about 90% of people who experience hallucinations, delusions are not proactively telling their doctors. And, when we hone in on that, why? So, to start, people living with Parkinson's may not feel equipped to share this part of their journey. Caregivers may have concerns about what could be potentially happening to their loved one if others knew that they were experiencing the symptoms. It often can be embarrassment or fear or a stigma that there's a mental health issue or what's perceived as a mental health issue. So, that also is something to think about. And oftentimes, patients or the caregivers may not even realize that hallucinations and delusions are part of the disease. So, it's really up to us to not just wait for our patients to bring it up, but to proactively have this discussion for every single patient that I see. Even if they've had Parkinson's for 6 months or 25 years, it's really about discussing it, talking about the non-motor symptoms, talking about what they're experiencing, maybe part of the condition, and, in my practice, I've seen how important it is to hear from those caring for their loved ones with Parkinson's and understanding the full picture of their symptoms. So let's be open. Let's have the discussion and really talk about the full breadth of symptoms, with your physician.
As you're describing some of the symptoms and what these topics are, kind of brings back haunting memories, but also those that are important. So others are not in fear like I was, because my mother had Parkinson's for 15 years. I only heard the word Parkinson until the seventh year when it started progressing. We don't even know why so quickly, but I won't get too into it again because I want to hear more from you. But there's one area and day I'll never forget. It was my mother, me, and my daughter at the time. She was about 6 or 7 in her bedroom, my mother's bedroom. My mother just turned to us and started hugging her pillow. And we all kind of giggled, not in a mean way, just in a kind of confused way. And my mother started saying how much she loved my daughter, Brooke, but Brooke wasn't the pillow. She was sitting next to her. And I didn't even know what to say to my daughter. I didn't know what to say to my wife, to my mother, or to myself. And I think if I met you and more to Parkinson's, then I think I might have been able to not rest, but at least be at a little at ease. So as we begin today, many people we've talked a lot about on this show are very similar, or not similar, but familiar. My apologies to Parkinson's, some of the motor symptoms of the disease, like tremors, and we know my hero Michael J. Fox, unfortunately, struggling with the external tremors, is also internal, also balance and thing. But one area that we don't talk about a lot is the non-motor symptoms like the hallucination delusions. I know you touch on them, but it's hard, I guess, even as a practitioner, because they might not be showing those symptoms in your office. It comes at such sporadic times. When my mother was really throughout the day, sometimes at night, and we had to take out her phone at one point because she started calling the police in fear that the aides around were going to harm her. And then I had to install video cameras, but there was nothing going on. Maybe you could touch a little bit more about some of the symptoms that aren't always seen to the public.
Oh, absolutely. So, I mean, and again, it's amazing to hear from your own experiences what you thought, and exactly had we had resources, such as More to Parkinson's, back then, I think it would have just brought up, a just better level of understanding. And I know you're going to show the website, but again, I really like on that website, moreToParkinsons.com, there is a doctor discussion guide. As well to equip patients and caregivers on how to proactively to have the discussion and talk about it. Again, that open communication is very, very important. And everyone is very different, but definitely hallucinations and delusions, again, are common. 50% of patients may experience them. They are non-motor symptoms, in addition to other non-motor symptoms I'm sure that you've discussed before in your podcast. And again, it's important to act because, again, if someone starts to lose like insight into these things, it just tends to worsen. So this is why we want to be proactive and bring it up, and have that discussion, and prompt the right path forward, by far. So resources are absolutely crucial.
Thanks. Yeah, I'm going to share that now, and everyone can go to moretoparkinson.com. We're going to also share the link, and definitely hope to. And this conversation, even after our show ends, doesn't really end. It has to continue. We have to share this, support the doctor, and More to Parkinson's. Share the link, share the show. We really need everyone in the world to understand these areas to make improvements. This might be a tough question, but is there a way to really predict who might develop hallucinations? I know my mother unfortunately seemed to have everything that could possibly happen, and I don't know how or why, but there was one, it's not always negative hallucinations, which is another odd topic. One time she said she saw her mother, her former animals, and she was smiling and seemed actually made her happy. So it's kind of such a odd thing. And obviously, whether they're happy or sad moments, it's tough for the family and the caregivers, but maybe you could touch a little bit about, predicting it. And again, I'm not going to speak for you, but it's got to be a tough job, because you're dealing with these individuals who are coming for help, want these things to stop, but sometimes you just have to, since everyone's so different, every journey is different, it's hard to find the right answer.
So you absolutely, called it in terms of just in general with Parkinson's. There's no two people that are like. I always say if you've seen one patient with Parkinson's, you've seen one patient, because everyone is so different. And Parkinson's related hallucinations and delusions can look different in each individual. So there's really no way to accurately predict who will go on to develop the hallucinations and delusions. Again, although these are more commonly seen in later stages, I have many people that have these happen in early stages as well. So really beyond just prediction, I think open discussion, to reduce any discomfort associated with these symptoms, having kind of normalizing these conversations, can really just help patients, their loved ones, speak more honestly, more frequently. But in regards to predictability, it's very, very difficult to see. And that's why I think because it is so common, we want to proactively ask about it.
Thank you. And the website is incredible. I've reviewed it before the show a few weeks ago, before I knew we were having the honor to have you as our guest. What are some of the reasons people don't, you mentioned earlier, but maybe they're not, proactive or sharing with the doctor all the symptoms? You think it's more they're just not aware, or because it's only 50% of the patients?
Oh, no, but I think it's definitely they may not feel equipped to share this part of their journey. They're not aware. There's an embarrassment or stigma amongst patients. They're worried potentially, that this is a stigma of mental health issues. Um, so I think there's so many different facets, in terms of like embarrassment, stigma, lack of awareness, lack of education, not understanding that these are symptoms of Parkinson's. So I think again, it's really up to us to be able to bring this to fruition, and that's why a campaign like More to Parkinson's is just absolutely crucial. And you're absolutely right. The website is has lots of great information. It's in depth, and again, I really like that doctor discussion guide as well.
I actually happened to be at the Unity Walk for Michael J. Fox a week or the same week. I think you were presenting or speaking on the topic. And I don't want to spend too much time because it could take hours, but the honor to have Mr. Reynolds join in this discussion. I know we reach out to a lot of celebrities. We've had just recently, Scott Hamilton was on our show, the famous Olympian, and we had Bernie Kosar on. Had several celebrities, which I wish, didn't have to. But as long as we have awareness, I feel we all have to be a family in the fight. We might reach, people on our own, but together, I feel our voices are so much stronger. What was it like, having his voice is really, I think, powerful, and maybe we can also get a little bit into the website and what everyone listening might be able to locate or find here.
Yeah, I mean, I always say that, for a patient with Parkinson's, you have to be your own advocate, but having good advocates around you is just makes a tremendous difference. And George, you're an absolute advocate. Being able to present with Ryan Reynolds, again, he's an extreme advocate. Everyone at the More to Parkinson's campaign. So I think, again, it's just really strength in terms of really trying to provide advocacy, education, and really, just as you do, George, you share your own story to hear that from others, who've dealt with this and, seen it firsthand. I think it's just the most impactful thing because, again, that's true education is learning from each other. So, again, events like the Unity Walk and, working with More to Parkinson's and other foundations are really the way to go to really empower everyone to live well with Parkinson's.
And you also touched on it, but what kind of advice can you give a family member, caregiver, even a friend, neighbor who might be seeing their loved one experience some of these areas, but might be hesitant to talk about it?
So yeah, I mean, some tips that I usually will give patients is essentially, again, it's challenging, but it's important to remember that the hallucinations and delusions can be non-motor symptoms, which can potentially be confused with other mental health disorders, and patients might be embarrassed to speak up. It's very important for people living with Parkinson's and their caregivers to tell their doctor if they start to experiencing any of these symptoms. Open communication again is really the key. I always say before you go into your next doctor's visit, sit down with yourself, your loved ones, talk about what you want to get out of that visit. And in particular, if you are experiencing anything like hallucinations or delusions, we need to bring it up. Again, don't hesitate to share your experience. While every journey is unique, discussing all aspects of the disease with your care team is essential. Always mention any hallucinations or delusions. This is not something that should be overlooked. Sometimes the appointments are really busy and we don't have as much time, or we're really focused in on other things like motor. But again, if these are occurring, they need to be brought up at every visit. I also think caregivers speaking to other caregivers is really essential, learning from each other, because it is a tremendous burden for anyone to carry around something like this on their own. And in the moment, some tips for dealing with them. I always say stay calm and patient as you listen to your loved one. For the caregivers, don't try to argue with the person if they're not aware that their hallucinations or delusions are not real. Um, Try to avoid any distressing topics, which may be a trigger. And again, the key would be talk with their doctors about ways to create like a safe and supportive environment.
Yeah, and I wanted to recommend, I'll be doing it right after. I think I'm already subscribed, but please go to moretoparkinson.com. Only have to go to next steps, scroll to the bottom, and you can sign up right there, like I just did in just a second. So there's no excuses, everyone. You can be right there, informed with the doctor and all they're doing. Also, you can follow them on Instagram, which we already do. I want this up to 1 million. So until there's 1 million, we won't rest. Some incredible information. And there you are on this picture, which I liked. I loved.
Oh,
Let
well,
me know
that's very
most of
nice.
the
And in particular with our
Go ahead.
dedicated patient who is just absolutely amazing,
Mm.
ninja warrior.
And also you have a Facebook page, which is very important too. So again, we want to get this all out there. So everybody, please support all the doctor does and also More to Parkinson's. As we kind of wrap up a few moments, I just want to know if I could ask a few questions more, for you. One of them was, who is your hero and inspiration? Because this is not something, maybe I'm wrong, but a child, wakes up and realizes they want to do, but you've touched so many people for the better and really changing the world for the better for so many families. Just curious, who is your hero?
Oh my goodness, it's a very deep question. I've been so lucky to have so many wonderful advocates along the way, some wonderful mentors. Actually, when I trained at Mount Sinai, my chairman was Warren Alano, Dr. Alano, who was a pioneer in the Parkinson space, who unfortunately recently passed away, and that was really a big blow to our community. And so definitely just so many mentors. I would say probably I'll answer that as my mother. I went into neurology because she had a very advanced form of multiple sclerosis, and really led me into neurology. But then when I saw all of the progress that was being made with Parkinson's disease in particular, movement disorders, I knew I had to kind of focus in on that field. So it's been an absolute pleasure. And I've just had some wonderful heroes and mentors along the way.
Do you ever have a burning question kind of in your stomach that you never thought to ask because you believe there's no answer, but one that you always, wanted to have a response to?
Oh, probably. Yeah, I guess why my kids don't listen to me more, or what goes on in the neurological realm of a child's brain. But those are kind of it. But I think we're getting a lot more answers to questions related to Parkinson's and movement disorders, and in general, like I said, when I first started in practice, we weren't even talking about hallucinations and delusions. So now to have a full-fledged campaign, I mean, I think is just absolutely wonderful.
Well, we want to thank you, the whole staff, everyone behind the scenes who was able to help us put this together. First thing I did when I saw all of your movement, really, it's a movement a few months ago. I was like, I need to have them on, not just because my own selfishness, because I do love this, I learn a lot, but I feel like we need the world to also be a part of it because, like I said, when we started, I didn't even know the word hallucination, delusion, whether I have a lot of school or even experience in law enforcement. I never heard of it till I was right there in the moment. And I found myself worse than a juggler in a circus trying to figure out, the Parkinson's symptoms and the hallucinations, delusions, and dealing with the fear and then my own fear, anxiety. Is she going to fall, get hurt? But I didn't have time for that because then the delusions and I'll have to send you a copy of our book. But if you heard the story the first night of when we discovered hallucination delusions, it was tragic. My mother went for a special trial, and I'm for trials, but and I don't blame doctors or the medical field. I blame the disease. But got a call one night at 4 a.m. Rush over to my mother's house and found her moving her furniture out of her house. So I said to her, "What are you doing, Mom?" And she's the kindest, positive, quietest person. Not, And she said she's in fear that there's Nazis in her home and they're going to harm her. So we had to rush her to the hospital. We saved her life that night, but they said it was delusions, hallucinations, and her life was never the same after that. And
Yeah.
again, I think that having More to Parkinson's and your work out there before that would have at least kept me kind of calm, knowing there are ways and people who can support you and also talk to if you are in such a situation, which I do hope no one ever is. As we kind of wrap up, and I always say not to end because it's to be continued, Is there can you leave the Parkinson's community today with some words of encouragement?
I'm always one to really believe in a concept of living well with Parkinson's disease, but we're all in this together. We've made tremendous strides in both the motor and non-motor symptoms in the last couple of years, and the pipeline is only continuing to be fueled. So please stay positive, take care of yourselves, be your own advocates, but have good advocates around you. Let's learn from each other. And let's get More to Parkinson's to 1 million followers. I agree. That would be a big, big step. So.
Well, I want to thank you for your time again, everybody else behind the scenes and out there listening, because this is really what it's about, for awareness. I don't accept anything except that no one's alone in this fight for a cure. And again, I just had a little message for you, doctor, and for the staff at More to Parkinson's, and for our listeners. We love you. We support you. We care a lot about you, and you're never alone. I, along with the doctor and More to Parkinson's, will advocate for you. And together, I feel our voices are so much stronger. And I always conclude the show with just saying, I'm just getting started. Because as the doctor and I said before the show started, this has been tough days, days that I just feel like I might not be able to do this anymore. And then I find something, it literally pops up like, in my social media and More to Parkinson, and then I kind of just get inspired but excited. It's weird to say get excited because it's such a tough field, but I did, because I think this is really important, definitely needed more than ever, and grateful again for all of your time, your work, and friendship. And I hope if you all ever need anything or next big announcement, or Mr. Reynolds would like to join the three of us, feel free. There's always a place and home for you here at Together for Sharon as well.
Such wonderful words, and please let me know when you're next in New York. And it's an absolute pleasure. Thank you.
Well, thank you, Doctor, and thanks everyone for listening. This has been another episode of Q&A with Sharon's son, George. Please stay tuned for a lot more to come, because we still have work to be done. But I'm confident knowing that we have the doctor here working 24/7, and More to Parkinson's, that we're in really great hands, and we'll be fighting right by your side around the world till there's a cure at your doorstep. Thanks, everyone. Thanks, Doctor.
Thank you. Thank you. It's a pleasure. Take care.